So good evening, everyone. On behalf of Cleveland Clinic Community Care, we welcome you all to COVID-19 vaccination in the Black community. My name is Austin Kirkland, and I'm the program manager for community health here at Cleveland Clinic. I will also be your moderator for the event this evening. I want to thank you all, the viewers, for joining in to listen and hear some of the important things that we have to say within this conversation today. Today, our guest leaders are from Alpha Phi Alpha Fraternity Incorporated and from the NAACP Greater Cleveland, here to open their ears and listen to you all, the viewers, to have this great discussion on COVID-19 and vaccine. So I'd like to go ahead and start introducing our panelists for today. Our first panelist is Danielle Sydnor. She is the president of the NAACP of Greater Cleveland here, and she is also the founder and CEO of We Win Strategies Group. Our second panelist for today is Brother Tevis Gordon. He is a nurse practitioner specializing in family medicine here in Northeast Ohio Neighborhood Health Services. Our third panelist for today is Dr. Jeffrey E. Sterling. He is the Surgeon General of Alpha Phi Alpha Fraternity Incorporated, and he is also the president and CEO of Sterling Initiatives. Our final panelist for today is Brother Lester L. Holmes. He is the president of Delta Alpha Lambda chapter of Alpha Phi Alpha Fraternity Incorporated. I want to just take a second just to thank all of our panelists for being here and agreeing to participate in this discussion today. To the viewers that are tuning in currently, this session will open up for a Q&A period at the end of our panelists' presentations. If you have any questions, please type them in the chat box and they will be read and answered live. We will try to answer as many questions as we possibly can within the time. And just so you know, this meeting is being recorded and will also be available for you all to be viewed later on our website. So historically, minority communities have a mistrust of the healthcare system due to decades of structural racism and misguided medical experiments, such as the Tuskegee syphilis study. According to a recent study from the Kaiser Family Foundation, 35% of African Americans were reluctant to receive the vaccine. Amongst the biggest concerns, 71% of respondents were cautious of side effects, and 50% of those respondents worried the vaccine will give them COVID-19, even though the vaccine does not contain the virus, the live virus. We also know that African Americans are disproportionately affected by COVID-19. So according to our recent data from the Centers for Disease Control and Prevention, African Americans represent 12.2% of COVID-19 cases and account for 15.3% of COVID-19 deaths. To put this in perspective, African Americans make up roughly 13% of the US population. Now, I would like to start our discussion and go and dive in a little bit deeper into some of these subject matters. And I'm going to start off with my first question to President Sydnor here of the NAACP. My first question is, we know that there is a great deal of mistrust in the community about COVID-19 vaccine. And you as a trusted voice in the Black community, how does the conversation start about trusting the process?
So I just want to say, first of all, thank you, Austin, for pulling this together. We know that we can't have enough conversations about this. There are so many people who are concerned and they're listening to friends and family, but they also need these types of platforms to hear from healthcare professionals and to hear from leaders in the community. So I want to say thank you for the opportunity to participate. But I think when you ask the question about trusting the process, it is really about making it individual. So many times information comes out and it's painted with a very broad brush, and we're supposed to just trust what people say, but we know that we, especially as a Black community, are very word of mouth driven, are very, you can show me better than you can tell me. And so what we're really doing right now is relying on some of our elders that have already received the vaccine. We're relying on first responders and people who fell into some of those early essential categories that have been able to successfully have the vaccine and move on through life. And then we're also relying on individuals that unfortunately have had loved ones that have succumbed to the virus, who are really making the appeal to say, I can tell you how personally devastating it was to watch my loved ones suffer and ultimately succumb to COVID. So really, when you think about that, trusting the process, I think it has to be individual. We have to keep having conversations like this. And I'm really trying to encourage folks in my age group, my contemporaries, to have conversations with their parents, cousins, aunts, and uncles, because sometimes the younger generation, we're also looked at as the voice of reason, that we may have more access to technology. We might understand this stuff better. And so we can break down sometimes the things that may be confusing to others.
Yeah, absolutely, absolutely. And one thing you said that stood out to me as well is the accountability of not only those younger generations, but also the more mature generations as well. We all are accountable for each other within this conversation. And that leads me to my next question as well. In President Holmes, and this is both to President Holmes and President Sydnor, what are some of the things that you all are hearing? Because you all are leaders in this community. You have been so impactful, and your voices are so strong. And not only are you leaders, but you're the voice of the people. So I'm curious to what are some of the things that you all are hearing from the community members?
Good evening, everyone. And before I get started, I want to say thank you to Cleveland Clinic for putting this forum together. I think this is a powerful tool to reach our community and show unity among different groups and organizations about the importance of COVID-19 and the importance of protecting everyone as best as we possibly can. So thank you. To answer your question, the conversation is evolving. Initially, when the vaccinations came out, some people had concerns about this is too fast. How is it out here so quickly? It took way longer for the flu vaccine to come out than what's going on with Pfizer and Moderna or what have you. So the conversation is kind of evolving to that, to now, since we've seen people get the vaccine, we've seen people respond positively to the vaccine. We're hearing that numbers are slowing down as far as spread. So the conversation is evolving now to people being more, and particularly in the African-American community, being more open to receiving the vaccine. So now the question is, how do I get my shot? Where do I go to get scheduled? Am I in the group and the parameters to get a shot right now? So those are the questions that we're hearing now. The conversation is evolving.
Just add to that, we have a healthy amount of interest from individuals who want to get the vaccine, but there's still a fair amount of distrust, and especially people that feel like, I'm young enough, if I get COVID, I'm gonna be okay. I've had someone tell me, I think they're cutting the vaccine with something. I said, this is not the bar. Nobody's cutting the liquor. This is the vaccine. You've got reputable companies that literally have their reputation on the line, and their desire to continue being able to provide this type of medicine and treatment in the future when other types of pandemics and things come around. They don't have any incentive to do something that's going to harm a significant portion of the population. And then being able to try and connect people back to understanding, to some of the things that Lester said, that there's a lot of data and research that had already been happening around coronaviruses, not necessarily COVID-19, but that's not a new virus. This is a new strain of the virus, and really just kind of walking people through their concerns. But yes, we're still hearing some very concerning things, I think, especially from younger people. So I think as we continue to talk about vaccinations becoming available, I would love to see more forums and more platforms where we're talking to the 20-year-olds who, just like the ones that don't want to go sign up for, Obamacare, they also don't want to get the vaccine. And we got to help them understand that your age is going to catch up with you at some point. You would have hoped you got the vaccine so you don't have these other issues down the road.
Yeah, and that's very important as well, too. And it kind of goes right back into the accountability factor of where we are, and also being in the present state of mind of we all should be accountable for each other. Because you're right, President Sydnor. I think sometimes when you think of the younger, more mature generation, they think it's impossible for this to happen to them. But it has happened. Percentages has happened. And those death, and sad to say, those death rates has happened as well too. And that leads me to Brother Tevis Gordon here, who firsthand experienced this himself. So Brother Tevis Gordon, just curious, not only have you experienced COVID, but what are some of the things that you would say to people on practicing COVID habits from a prevention standpoint?
Oh yeah. Good evening. As people have said before me, thank you again for inviting us for this discussion is very important. As far as prevention, I do think that prevention and reducing the spread of COVID is crucial to us returning to some sort of normalcy. Not only in the States but throughout the world. Studies have been showing that the best prevention and reduction is through vaccination. Many of us are familiar with the Pfizer and Moderna by now, and the studies have been saying that they're about 95% effective in reducing COVID. Not only reducing contraction, but also transmission between people, and as well as especially hospitalization and the severity of sickness. So I believe that that is the way to prevent the spread of COVID. But in addition to that, also the continuing what we're doing as far as wearing our mask, washing our hands, and keeping our distance, and not being in crowds when we don't have to be. All those things together, will help us to reduce and continue to further the decline of the transmission of COVID. So,
yeah, absolutely, absolutely. And I want to stick with you for just a second here, because you being on the front line as a nurse practitioner, how do you see COVID affecting the Black community here?
So it's a little different for me. As a primary care provider, I'm in the outpatient setting. So my experiences with COVID are a little different than someone who's in the hospital or, in the ICU setting. Because I primarily care for healthy and semi-healthy individuals. The effects of COVID in the community that are brought to me are kind of what we're discussing today. It's about the prevention. So not so much the death and sickness, but more so the lack of knowledge and the misinformation around the virus and around the vaccine. So as a frontline worker, I have a lot of patients who come in, they express their thoughts, they express their ideas, they express their theories about what's going on with the pandemic and, their hesitancy and why they're not getting vaccinated. And they tell me why I shouldn't be getting vaccinated and justifiably so.
Yeah.
I mean, as President Holmes and President Sydnor mentioned earlier, the African American community has not had a favorable past with medicine and science. So just being a provider and other providers and as I'm listening, it's not really a medical thing, it's also a community thing.
Yeah.
So President Holmes, President Sydnor, Dr. Sterling, we all have a fight in this battle to educate and provide resources for our people, because they have a legit concern. And yeah, so that's kind of what I see. It is the education of the vaccine and the virus.
No, absolutely. And I'm really loving this conversation right now because, we can be very transparent. And that kind of leads me into Dr. Sterling here. And we always get a question about how fast COVID-19 vaccines were created, right? So could you share with us briefly why African Americans should trust the vaccine development process, especially given the past history?
Well, I'm going to say some things, so stay with me. First of all, thank you for having me and thank you for doing this. There's a distinction between just flat out fast and efficient, okay? That's a distinction with the difference. Given how we embrace technological advances every year whenever a new Apple product comes out, we've shown an ability to be rapid adapters of newness when we're so inclined. We're in the middle of a pandemic, so I would suggest that the correct response to the production of what are very effective vaccines should probably be closer to thank you than to skepticism. Now, I talk all the time. It is completely reasonable for people to have legitimate concerns. What we don't want people to have is irrational fears. So again, let's just start with the premise that what's been accomplished here is actually pretty remarkable in response to a pandemic that is disproportionately killing Americans and African Americans in general. To your question, African Americans should generally be more pleased about this vaccine development process than perhaps any other recent news coming out of science and healthcare in the last generation. Begin with the premise that African Americans are disproportionately affected and dying from the virus. African Americans, Latinos, Indigenous Americans, and Pacific Islanders all have a COVID-19 death rate approximately double or more that of white and Asian Americans. Let that sink in. So we're not talking about a vaccine as much as we are a response to death. I'm an emergency physician by training, and one of the things that we always say is don't let a potential side effect get in the way of a life threat that's staring you in the face, okay? So let's stay focused on what's actually important. Now, why should African Americans be pleased? Well, consider at the beginning of the conversation things like Dr. Kizzmekia Corbett was actually amongst the National Institutes of Health scientists working directly to develop and produce the Moderna COVID-19 vaccine. Wouldn't you want to have an African American on the front lines making sure that this thing is what it needs to be? That's what we had here. Consider the participation of African Americans in the research trials at far higher rates than expected, so much so that we are actually overrepresented in this example, something that never happens before. In the recent Johnson & Johnson trial that just came out of 40,000 study participants, 17.2% of the participants were African American. That means that this data is directly applicable and extrapolable to our community. That gives you plenty of confidence, and given the safety profile that came out, that's a very good thing. Those numbers were 9.8% in the Pfizer trial, 9.7% in the Moderna study. We are represented in the study, and those studies were proven to be safe and effective, so we should feel good about that. Consider that the National Medical Association, the oldest since 1895 group of Black physicians in the country, actually sat and served as an independent watchdog for the interest of Black Americans to make sure that this study was not a remix of something like Tuskegee or the Henrietta Lacks experiences. They signed off on this. That's a good thing. Physicians like me actually exist explicitly because of the need to protect our communities. And I and we were more than ready to sound the alarm if warranted. It was initially surprising, and now it's actually thrilling to be able to tell our community that you shouldn't be skeptical as much as you should be trying to rush to the front of the line, because there's about a 95% effective solution that's available to us that has been demonstrated to be safe. So this glass is more than half full, and let's not stay so much focused on the parts that are half empty. Again, it's good to have reasonable concerns. We want to answer all your questions. We want to empower you, but let's not go chasing down the rabbit hole for irrational fears.
Absolutely. Oh my, and that's such an incredible. And now that leads me into President Holmes and President Sydnor here. How has the NAACP and Alpha locally impacted the Black community through this pandemic here?
I can start. I mean, I guess the NAACP, I think you started off by saying, trusted voices. So I think of the pandemic in multiple phases. The first part of it was utter chaos and confusion and people trying to figure out how they were going to survive. The number of people that were immediately faced with layoffs and unemployment and business closures. And now we're on the other side of it, where people are getting antsy and ready to go back outside and all of those things. And so I think we've tried to just really be a trusted voice. We've tried to make sure that we're viewed as a place that people can get access to quality information, whether it's about things like the vaccine rollout, places that they could get tested when testing was not readily available in parts of our community, or whether it's getting access to information about how they can get financial resources, rent assistance, things like that. So we're not trying to reinvent the wheel. We continue to find value in partnerships with organizations like the clinic and Alphas, because we know, again, all of us have a different pocket of the community that we have access to and that we can reach. And when we collaborate together, our impact is just that much greater.
Well, as Alphas, our job is to provide service and advocacy for our communities. And I can't think of a better time to provide those things than right now during this global pandemic. So at the beginning of the pandemic, we immediately realized that we need to get masks in the hand of our community. We need to get cleaning products, PPE, all those things in the hands of our community. So we partnered with organizations like the NAACP, like Neighborhood Connections, like the Cleveland Foundation, to get those things in the hands of our community members so they can clean, so they can have hand sanitizer, so they can have soap, so they can have cleaning supplies, so they can have wipes, so they can have masks, because we all understand that the more people who wear masks, the less the chance of the spread of the virus. So those are the things that we did to get into the community and to work with organizations to help pass and disseminate those things out to people who need them. We've also evolved some of our operations. We're happy to announce that now we have a food pantry, so that we're providing food for the community. So it's taking people away from, I don't have to necessarily go all the way across town to the grocery store. Now there's a pantry I can go to pick up some of my needs. So those are some of the things that we're doing as a fraternity here in Cleveland to support the community and to provide some relief during this pandemic.
That's excellent, and that's excellent. And from an overarching question now to Dr. Sterling, President Holmes, and Brother Tevis Gordon here. Why is this initiative so important to Alpha?
If you know anything about Alpha Phi Alpha, the bottom line here is that, there's a phrase that is critically important to us, and we need trusted messengers. There has been distrust of the medical and scientific and even public health communities because of what has occurred historically and what indeed continues to be the case in terms of production of healthcare outcomes. Organizations like the NAACP, Alpha Phi Alpha, and other members of that are community-based organizations actually are members of the community, have legitimacy and credibility inside of the community, and can distill that information and get to where we are having individual conversations with members of the community instead of sprinkling the equivalent of pixie dust across the community and expecting them to get it. This is hand-on-hand combat for the lives of every single individual, because you don't get to 500,000 by dropping a bomb on a community, figuratively speaking, but there have been individual decisions that have lost lives to that degree. And if community-based organizations are able, and as we are able, to actually dig deep into our communities, empower people, provide them with information and education that makes the difference. Because, the deal here is that, I want to take just a minute and get into this. You started with what I would describe as the glass half full proposition of vaccine hesitance amongst the African-American community. But I'm here to tell you a different story. Since that Kaiser Foundation data came out, if you actually look at what's occurred over the last 3 months, the numbers of African Americans who have actually said that they would be getting the vaccine was 41% in November, and now it's up to 62%. And the difference between the African American community and the general population really is quite small. So these type of community-based efforts where you empower people, educate people, and then allow them to make the decisions that represent them being better stewards of their own healthcare are effective. And looking at it through the prism of what organizations like the NAACP and Alpha Phi Alpha are able to do, we cannot overestimate the power of trusted messengers within our community. And that's why this is so critically important. And organizations like the NAACP and Alpha Phi Alpha know that power and know how to wield it. And I think that the success that you've seen in reducing vaccine hesitancy is being borne out to where people actually now are fighting to be at the front of the line instead of asking questions about, oh, I'm not going to get this in the first go around, all the while dying.
Absolutely.
Yeah, and just to piggyback a little bit off that, it's funny because in the beginning, I I didn't know how, the Black community was going to react to getting the vaccine. In my mind, I heard a lot of resistance, but as I, maneuvered kind of to the point of Dr. Sterling, people are longing and looking for people to trust to tell them that this is okay. Even when I speak with, my inner circle, or even, the networks and random conversations around, um, Black people are interested in getting the vaccine. People coming to the clinic all the time, interested and wanting to get the vaccine. Now, trying to find somewhere to get it is a can be another issue, but the interest is definitely there. And as Dr. Sterling said, I can see how that data supports that.
Absolutely. And I see that we have a
Respond to something that Tevis just said. We have registration codes, the NAACP does. So if you have individuals that are looking to get signed up to take the vaccine at the mass vaccination clinic, if you're in Cleveland, in Cuyahoga County, the Wilson Center, you can reach out to us at the NAACP. I'll put our information. Well, I guess I can't do it. There's no chat, the Q&A, but you can reach out to the Cleveland NAACP. Our email address is clevelandbranchnAACP@gmail.com. Or if you go to our social media pages, you can find our contact information, or go to our website and you can send us a note and we can get you a registration code for the mass vaccination clinic.
Absolutely. Absolutely. And to follow up on that information as well, before I come back to you here, Dr. Sterling, again, if anyone has questions, please input your questions within the Q&A portion here, so we can make sure we address that when we finalize our discussion here. But Dr. Sterling, I think one of the biggest questions that comes to people's minds is, what is the difference between Pfizer and Moderna, which are 2-dose shots, in comparison to the Johnson & Johnson, which is a 1-dose shot?
I love that question, because it actually indicates that people are gaining a sophistication about wanting to know what they're putting in their body. And it's a conversation for another time. If we could just get rid of sweet sugar and other such things, then we'll all be better off in terms of diabetes, et cetera. But to the question at hand, look, I'm going to apologize in advance for any scientists or other healthcare professionals that think I might oversimplify the way in which I'm answering this. But I mean, just think about the ways in which you want to fight a war. Okay, the old traditional way is that you probably grab something that's equivalent to a crash test dummy, and then you let the Army practice fighting on it. Okay, that's kind of what these old vaccines that we've used, whether it's a live virus or it's an inactivated particle of a live virus or some other such thing. That's kind of what the Johnson & Johnson old model looks like, okay? So think about it that way. You're actually letting your body, the immune system, practice beating up on a piece of the virus, or an inactivated, not live, part of the virus, so that when the real thing comes around, you've had practice and you know what to do. You can, in medical speak, develop an appropriate immune response. The innovation that occurred with both Moderna and Pfizer is that somebody figured out, and for those of you that know about Star Wars, think back to the battle plans when they were trying to figure out how to kill the Death Star. Well, if you can actually steal the plans without having to fight the crash test dummy, and you have the secrets, then whenever the thing shows up, boom, you're ready to go. And that's the innovation that has occurred. And that's why this was able to be done so expeditiously. What actually is occurring is that the mRNA particle, and by the way, that's what, technically speaking, that's what Pfizer and Moderna are. It's messenger RNA. And basically, it's like an email that's being sent to the muscle cells at the injection site. And it shows what a little piece of the viral protein looks like. And then, like a Snapchat message, it just disappears. But the message stayed behind long enough for our bodies to develop an immune response that taught us how to kill the viral protein, and thus the virus, when it shows up at any point in time in the future. So it's a much more simpler way to teach our bodies how to develop an immune response to not particularly the virus, but to the part of the virus that invades our cells and causes disease. So Pfizer and Moderna actually are 2 doses. Because that messenger RNA is such an unstable particle, it needs to be refrigerated at very low temperatures, frozen even, because once you unseal it, you only have about 6 hours before it becomes denatured, it becomes inactive. But on the other hand, the Johnson & Johnson, the 1 dose, it can actually be stored in a refrigerator. So we'll get into what that means in terms of the relative efficacy levels. But the truth of the matter is that this conversation is a distinction without a difference, because the bottom line and what we should be really focused on are the outcomes. And we literally have the best 3 vaccines in the entire world. The good news is that they all work and they're all safe. So that's the conversation that we need to be focused on. And the question that everybody asks after they ask what you just said is, if you had to pick one of them, which would you take? The correct answer to that one is whichever one you can get your hands on first, because they're all safe and they're all incredibly effective. So this question, although once again, I'm not going to be condescending to anybody, represents a distinction, a distinction without a difference. Just get vaccinated.
And I'm glad, and you followed up on my second question as well too, about, you know, which one is more effective. And I'm glad you put that out there to the audience as well too.
Let me climb down the rabbit hole. There's a very important point about that. You're going to think about this in one of 2 ways, because, you know, just like with the flu vaccine, and this is not the flu vaccine, there are different considerations that people want to talk about. These vaccines do not prevent you from getting the disease. They prevent you from dying from the disease. I cannot stress how important that is. There is nothing on the face of the earth other than a mask, if you walked around with a mask all day, that's going to stop somebody from sneezing in your face and injecting viral droplets down your lungs. That means you caught the virus. Now, in order to catch the disease, the virus has to replicate X number of times to get a critical mass that then causes disease. What these vaccines all do at various levels of efficacy is stop viral replication so that you don't catch the disease. Okay, but you can't catch the virus, because if you breathe, you can catch the virus. But the point to be made here is that these vaccines, 2 of them at least, are 100% effective in stopping hospitalizations and death. So if you're worried about, like I said, it's not going to stop you from getting the virus, but it'll stop you from dying from the virus. Now, people always complain with other diseases, oh, I got the vaccine and I caught the flu anyway. So what? But did you die, as the meme says? So the point to be made here is that, look, if the outcome of interest is survivability, all 3 of these are fantastic. So I love when people bellyache and pain about their aches and pains in their arms and, you know, the chills and all the rest of that. But did you die? No, and you're not going to die. So let's just point that out real quickly. J&J literally is about 66% effective in preventing disease. Both the Pfizer and the Moderna are about 95% effective. Let me tell you this, you had us at 50%. We would have declared this a huge success if the data had come back at 50%. The fact that we're talking about 2 of these things that give you a 95% efficacy rate is fantastic. And that's the United States based. As I said, we have the 3 best in the world. So kind of keep that in mind. Go get vaccinated.
Absolutely. And to follow up with that as well, some people think the vaccine, it alters like your DNA. Can you please like dispel that notion for us?
Just did. Once again, you know, I'm not going to play whack-a-mole on 5,000 different myths. If you could explain to me, and again, I'm not being condescending, I'm just being real. Give me some scientific basis on which you would believe that it causes any change in your DNA. Yeah, I can't explain to you why it doesn't, because there's no reason for you to even think that it does to begin with. But suffice it to say, I can simply say, of course it doesn't. It never would have gone through the institutional review boards. It never would have been met with scientific approval. And you'd have individuals like me, my colleagues, and the public health community and others crying to the mountaintops about how this should not be used in any members of the American community. That is not the case. So once again, it's good to have your reasonable concerns, but we can't chase irrational fears down the rabbit hole. We have bigger fish to fry, and we have to spend our time saving lives, not addressing things that have no basis in scientific fact or even theory.
Mm-hmm. Absolutely. And I'm going to come back to you, Dr. Sterling, here. And I have a question for you, because we have some great questions coming in from in the Q&A portion. And I want to address this question to Dr. Sydnor and President Holmes here. And this is really great. How are each of the organizations reaching those people that are not necessarily tech savvy and don't have that access to online information?
Well, for what we're doing about this situation with COVID-19, that we are working with organizations, medical professionals and whatnot to actually get ready to walk in the Buckeye community. For those who don't know, our house is located on around 116th and Buckeye. So we're in that Buckeye, Shaker, Woodland, that part of Cleveland. So we're getting ready to walk, to hand out information, first of all, on how people can get the shot and how people can register for the shot. So we're putting the handbills directly in their hands. So that's going to happen within the next week or so. We're going to start taking on those measures to make sure that we're really out here knocking on doors, reaching out to the community to put the materials in their hands that they need for those who aren't technologically savvy or for those who aren't on Instagram, Twitter, Facebook, or what have you.
You know, I think I would say I'm a bit disappointed in what we've been able to do, partly because we're continuing to have these hot conversations with the governor's office, but not receiving the type of support that we need. And I don't think that they should come to Black organizations and ask us to do stuff for free, that they get resources to be able to help spread dollars around. Because if they care that much, put your money where your mouth is. And I would even add Cleveland Clinic to the list. And this is no shade to you, Austin, and the team, because you guys are tasked with the same thing. We've got these organizations out here that get billions of dollars, and they need to invest in our communities. Alpha Phi Alpha shouldn't have to do it out of their own pocket. The federal government has provided adequate resources in terms of vaccine rollout and distribution and marketing and all of those things. And we've provided some of these organizations with examples of strategies to do things like teletown halls. We know we've done it during the campaign season. We've expressed that the same strategies we use to activate Black folks to vote are the same strategies that we would use to activate people to get the information for the vaccine. But it takes money to do those things. And we can't rely just on volunteer efforts to do this. So for those that are listening and watching, yes, I said it, tell the governor to give us some resources, and we can do more besides free technology, which doesn't cost us a lot.
And let me jump in on one point, Brother Kirkland. Yes, there are people in our community who are not technologically savvy. They do not have access to the internet. They do not have Instagram, Facebook, Twitter. But there's a large segment of our population that has access to the internet. They have access and ability to research for themselves and make the best decision for themselves. Let's not go so far that we take away personal responsibility from our community to do what's best for them, to filter through the rumors, to filter through the fluff, and get to the facts. The information is out there, so let's make sure we encourage our community to do their research and make the best decision for them and their families.
Absolutely. And coming back now to President Sydnor, and we have a question that's addressed to you is, can you speak a little bit more about the registration code that the NAACP can provide, and does having a code facilitate getting a vaccination?
Yes. So again, if I'm gonna say bad things, I'm gonna say good things as well. I don't think it's bad things, just
right.
But the governor's office has provided us with 200 registration codes. So essentially, if individuals reach out to us and we provide the registration code, you are guaranteed a spot at the vaccination site. The goal is to make sure more members of the Black community have access to get vaccinated. So when you email us, right now, it's still for people 40 and over. Starting Monday, anybody 16 and over will be able to get vaccinated. I think they have like 6,000 spots a day, and they're setting aside like 2,000 spots for individuals from Black and Latinx and marginalized communities. So if you want a vaccine, send us an email. We'll send you some information back for the registration code, but it's only good for the Wolstein Center location. So if you're trying to use it at Giant Eagle or anybody else, we don't have any access there, just at the mass vaccination site at the Wolstein Center.
Absolutely, absolutely. Now coming back to you, Dr. Sterling, a question that was posed is, what are the age limits of the vaccines, and are there any vaccines in progress for children?
That's a pretty interesting topic of conversation. I would respectfully suggest that the reason this hasn't been studied in children isn't because it's not necessarily safe, but because priorities have been elsewhere. The individual cohorts that have died clearly have been skewed toward the elderly, the disabled, those with comorbidities, and the prioritization of this has been along those lines. To answer your question, both the Moderna and the Johnson & Johnson vaccines have been approved up down to age 18. The Pfizer vaccine has been approved down to age 16. Pfizer has just announced research that's going to look at lower ages, starting off with 12, so incrementally we'll work our way down. But given that time represents allocation of resources and all hands have needed to be on deck to immunize the entire population and to prioritize those most at risk for death, I think that's where the attention has gone. I would couple that comment with another pretty interesting piece of data that's come out. It's actually shown, and by the way, the American College of Obstetrics and Gynecology and the Society for Maternal Fetal Health both have come out and said that providing vaccinations to pregnant mothers is actually safe. And there have now been examples of babies that have been born to mothers that have been vaccinated who actually have antibodies already formed against the disease. So that actually is supportive evidence that as we work our way down, don't take this any further than what I said, please. This is not accepted medical science at this point, but that's actually suggestive that we will work our way down eventually throughout the entirety of the age spectrums. We just haven't done the research on it yet because the priorities have simply lied elsewhere. So at this point, you can get a Pfizer vaccine if you're 16, otherwise you're going to continue to wait. If you're as low as 18, you can get any of the three.
Absolutely. And my next question is to both you, Dr. Sterling, and Brother Tevis Gordon here is, and this is a question from our Q&A portion, is, can you help me understand the side effects? And one of our viewers stated that their arm has been hurting for about 2 days now, but her husband, who is about 55 years old, have been completely out. So can both of you be able to address just her concerns with that? That's a really good question.
Let me let Scott start and I'll finish up.
I'm sorry, I missed the last part of the question, Austin.
Yeah, no, absolutely. So one of our viewers just have concerns about her arm has been hurting since she has gotten the vaccination. But her husband also had got the same vaccination and he is completely out and rest, tired. So can you be able to just address just some of those concerns?
I mean, I think that with any vaccine, people react differently. I do think that as far as her arm hurting, that is a common side effect that people are experiencing with the vaccine. So, I mean, he may be milking it, but I think that just the vaccine, it affects people differently, and that yeah, that's that. He'll probably be up and going soon. And Dr. Sterling may have,
Sure. What you're feeling, imagine, if you will, if there was a war, there's going to be some rubble left behind. And it's really just that simple. The aches and pains. Imagine if I stabbed you in the arm with a knife. Yeah, you're probably going to have pain at the injection site. And that's pretty much you're seeing. So that's point number one. Point number two is that the immune response is what you're feeling. That's actually a good thing in many examples, that you can feel your body mobilizing an immune response. So the fact that you're having lingering arm pain there at the site where the vaccine perhaps was most concentrated indicates, well, yeah, well, remember what I told you before about the email being sent to the muscle cells at the injection site. That's going to be most pronounced in that area. And for people that get chills or worn out and just fatigued, that's just the way in which, as was pointed out, your body is mounting an individual response to this. One of the curious pieces of the data, and the gentleman who asked the question just barely gets off the hook, data has actually shown that paradoxically, you're more likely to be knocked out if you're under age 60. We might think that people over age 60 would have a harder time with the immune response being mounted, but it's actually the opposite of that. So give the guy a pass who's being worn out. But there's another question that always gets asked along those lines. You should not be pre-medicating with Tylenol or Motrin or other such things before you take the vaccine, but it is okay to do so if you're having significant pain afterwards. And just push plenty of fluids, and those really alleviate plenty of the symptoms. I myself, after the first dose, I got the Moderna vaccine. I actually had the arm pain itself. And one thing that I've heard from a half a dozen different individuals is that if you sit around for the day or two after the vaccine, you're going to have that pain. But I know one person, several people who actually did things like went to play golf or did 100 push-ups or went and played basketball. Once you started using the arm and circulated the blood around there, the pain went away. So just don't rest and do nothing. Get out there, get active, and maybe that'll help. And by the way, I think it's important to point out that I'm actually an emergency physician by training. And so I am actually seeing people in that setting. So it's just important to know that some of the things that you've asked, I haven't commented on because both the outpatient setting and the inpatient setting have presented opportunities. And I certainly sign off on the comments that have been made about some of the patient experiences.
Absolutely. And to follow up with that, there's concerns that the Johnson & Johnson vaccine being so readily available within the minority community, are we getting second best after that?
Nope. Let me tell you something. If you gave me some Truth Serum and put a Johnson & Johnson in front of me, I would grab that one, and I might just grab it first. Okay. Now I told you, take whichever one you can get, but look at what your outcomes are. In that example, you're focusing on the wrong outcome. It's 60% effective across the board, but it's way more effective in severe cases. And what that study said, especially, is it is 100% effective. That's what you should be focusing on. It is 100% effective in the study in preventing hospitalization and death. So don't look at the 66% effective. Like I said before, it might not stop you from getting the sniffles, but it'll stop you from dying. And that's what I care most about. So I want the 100% solution. So if I can get one shot, if I'm needle-aversive, and be sure that I'm going to be 100% protected from death, it is a very smart decision to say that maybe that's the one I might want to grab first. But all three of them are good. But that is not a second best conversation. If you're focusing on the 66% instead of 100%, nah, you're missing the point.
Yeah,
but did you die?
Absolutely. And as we continue to wrap this conversation up here today, my last question here, Dr. Sterling, is how long does the vaccine last? And will the vaccine be required to take yearly like the flu shot?
You should plan on it. We don't have the data because obviously enough time hasn't passed for us to know the answer to that question. The science has recently wrapped up. We were saying that it's going to last for at least 3 months. Now the consideration to that is going to last at least 6 months. Now, we have to apply a caveat to that because you have to define what it is. COVID-19, the viruses that cause COVID-19 are not all created equal. We were doing the research on the strain that was originally most prevalent in the United States. Today, the variants that have come in from South Africa, Brazil, and the UK are the predominant, the majority of the strains that exist. That is not what the research has been addressing. So it is possible, and this is where the analogy with the flu vaccine is very much in play. Let's just take a quick second and go backwards there. We had a pandemic 100 years ago, 1918 and 1919, where hundreds of millions of people around the world were killed through the flu vaccine. Every year since then, approximately 35 to 75,000 people have been dying because the flu is very good at changing, creating additional strains, mutating. As we have already seen very rapidly, COVID-19, the virus that causes COVID-19 is doing exactly the same thing. So the vaccines that we are using are going to need to be modified probably on an annual basis. We have talked about lower efficacy rates of the existing big three vaccines that we have against the variant strains. They're not as good as the 95, and 66% numbers that we've been throwing around, but they're still good enough. So as such, it all depends on whether or not the American strains or the foreign strains continue to be predominant in our population as to whether the booster can then knock it out. And that's why, and that's been the fly in the ointment of this conversation. That's why we should always begin and end these conversations with prevention. An ounce of prevention is still worth a pound of cure. Now, if you have a bolus that's up here and then you get more variants, then it's going to exponentially shoot off into the stratosphere, which is what we saw by not getting rid of it before, by masking and distancing and doing the other things that we talked about. But if we continue to wear masks and we lower the bolus to here, when the variants come around, the amount of virus that's actually in the population is going to be sufficiently low that we really don't have to worry about these things as much. Case in point here, folks, mask. If I wear two masks, one that's a tight-fitting cloth mask med-surg mask. You don't need N95s or any other stuff. And then you put a face shield or some other mask of a different cloth consistency on. Double mask. This is from the CDC, by the way. And if the person in front of you is doing exactly the same, that independent of anything else offers you a 96% level of protection for that interaction. So interaction by interaction, you can protect yourself 96% by simply using public health best practices. So now if we had done that, and if we do that for the next 1 to 2 months, we can lower the bolus of virus in our communities and the country down so much that these variants can actually not really have the effect that they're going to have. If people would just calm down with spring break and all the other things that are super spreaders, we can actually get past this to the point to where there will be some low baseline numbers that occur every year, but it won't be the 3,500,000 people that are dying every year. We have to find a way to lower these things eventually, because if we don't, it will always be the catapulting phenomenon instead of starting the virus having to start from scratch again. So the answer to your question really is, we don't know, but the answer to those questions is much more in our hands than it is up to the virus itself in determining how long this is going to be around and whether we'll have to get boosters on an annual basis.
And that kind of been a perfect way to end this conversation as well too. I want to open the floor to all of our panelists if they have any additional comments that they would like to share to our viewing audience before we wrap up here.
I'll just say thank you again for putting this together. Again, for folks that are interested in getting access to a registration code, please visit our website, clevelandnaacp.org, and you can send us a note through our contact page, and we'll get back to you about getting the access code.
Again, I just want to thank the Cleveland Clinic for putting this panel together. I learned something today, and I hope and pray that the viewers also learn something. Let's be smart. Let's continue to wear our masks, to wash our hands, to use hand sanitizer or soap, depending on your situation, and to get the message out there that it's okay to get the shot. So thank you again, Brother Kirkland, for moderating this, and thank you for Cleveland Clinic for putting this together.
My message is always the same. I'm into empowerment of citizens to make better decisions for their own health and chase facts. And remember, an ounce of prevention truly is worth a pound of cure. We are so much closer to ending this than you would imagine if we simply would follow public health best practices. If you look at countries around the world that don't have the technological advances that we do, there are scores of countries that are armed with nothing more than implementation of mask protocols and sanitation protocols, who are doing infinitely better than we were before the vaccine program started. We've got this. We can do this. Just be diligent. I know that vaccine hesitancy is real. Vaccine fatigue is real, but we're going to get back to life, and we'll build back better. Not to coin a phrase, but hopefully we've learned something through this process that will empower us in a way that we will, in fact, be better stewards of our own healthcare. So thank you to Alpha Phi Alpha and NAACP Cleveland Clinic for holding this forum and inviting me to be a part of it. And that's it for me.
So I think everything has been said before me, and I just want to reiterate that, you know, a lot of information has been shared here today. So I just encourage everybody that, you know, is here or who may view this, you know, on demand to share it. And as Dr. Sterling said, we can do this, and I look forward to, you know, returning back to what we know to be normal, or at least some type of normalcy. So we got this.
Better.
That's right. And yeah, absolutely. And we hope that the information that was shared today from these trusted voices will help you make an educated decision about taking the vaccination when it is available to you. But also to that, as Brother Gordon said here, is to stimulate these conversations and continue to influence them and share them. This vaccine can greatly reduce the risk of illness and possibly death. This is such a time of great uncertainty, but Cleveland Clinic's goal is to always provide you with the necessary tools and accurate information. So we are pleased to work with you all hand in hand with you to get through this unprecedented global crisis together. The conversation doesn't end here. It does not end here. We have a variety of virtual events that are set up to answer community questions about the COVID-19 vaccine. So please look forward for future communications about upcoming virtual event webinars and to help us spread the word about these opportunities in your communities. We will also like to let you know that the Cleveland Clinic is now offering primary care services at our Langston Hughes facility here in Cleveland. As we wrap up, we encourage you all to take just a brief survey about today's presentation. When you exit the Zoom session, a web browser window will open directly into our survey. We hope you take just a few minutes just to provide us with some valuable feedback. We will also send a follow-up to you all and a follow-up email with a link to the survey to include additional resources and information about the COVID-19 vaccination and also our upcoming virtual events. Again, I would like to just thank our panelists, President Danielle Sydnor here, President Lester Holmes, our brother Tevis Gordon here, and Dr. Jeffrey Sterling for joining us here to address this much needed conversation. So thank you all, and I hope you all have a great evening.